firstly, thank you very much to Anne and to Lisa and their colleagues at Metla and Suka for inviting me to be here with you this morning. It's very unusual for me to be at a conference where I'm the only speaker in a language that I will understand. And so I've just used up my full knowledge of Finnish. So I will sit around if there's any questions afterwards. I understand that your discussions for the rest of the day are in Finnish, but I'll be here if anyone has any questions or would like to go through any ideas or any thoughts on the day with me later on. You'll find me sitting in the corner at the back with my laptop. So again, thank you very much for your welcome here this morning, and thank you also Lisa and Anne and their colleagues took me out to a wonderful dinner where I got to sample some Finnish biodiversity. I had a lovely reindeer steak, which was quite nice. So while we're just waiting, a quick introduction to what COHAB is. As Lisa mentioned, COHAB stands for Cooperation on Health and Biodiversity. The COHAB initiative is an international project which seeks to make connections between health and biodiversity in terms of international and local policies, in terms of the science behind environmental science and public health science, but also in terms of practical responses, looking at where biodiversity and health can be connected in a practical way that actually improves people's lives, improves people's health and well-being, while also conserving biodiversity and nature more widely. Our background is that COHAB came about as a result of a conference I organised in Galway in 2005, which was the first international conference on health and biodiversity. Myself and the colleagues who I was involved with at the time decided we would put together a meeting to see what the state of knowledge on health and biodiversity was. We came out with a report from that meeting which highlighted some of the areas such as drug discovery, infectious disease emergence, nutrition and dietary security and disaster risk and so on. It demonstrated there really was quite a clear link between biodiversity, ecosystem benefits and public health. One of the recommendations from that meeting was that there really should be some kind of a global initiative to try and bring biodiversity and health together in some kind of a practical way. And as a result of that recommendation, the COHAB initiative was born and we officially incorporated in 2007. Since then, we've been working mostly at the United Nations level to try and make sure that health is considered within discussions on biodiversity, such as at the Convention on Biological Diversity and other discussions of the UN Environment Programme, but also trying to make sure that the biodiversity issue is similarly recognised in international discussions on public health. Great. I was hoping I could go home. As well as working at that international level, we're also trying to bring it at the local level, making sure that these issues are connected in local and national policy and in national research, and also more specifically at the ground in terms of the delivery of primary healthcare. So I have a lot of slides here. I'm not going to go through them all. What I often do is put together a large number of slides which can be used by yourselves as a resource later on. If anybody would like a copy of this presentation, by all means feel free to email me and I can send you a copy. I'll give you my email address at the end. So as I say, I'm going to fly through a lot of these slides. There's a lot of information to give and I don't have a large amount of time. But again, it's something that you might find useful later on. Okay. Geologists and anthropologists and a large group of Earth system scientists worldwide are increasingly referring to this particular period of geological time that we're living in as the Anthropocene. The Holocene epoch is considered to have ended. We are now in a period that is characterized by a massive amount of global change, driven mostly by human activities. In fact, it's increasingly recognized that the activities of mankind, economically, politically, socially and culturally, rival natural processes in terms of their ability to shape the world that we live in. Unfortunately, that's also increasingly characterized by what's termed the collapse of resilience and resistance in natural systems. In other words, the ability of natural systems to bounce back after change, or to be able to resist various stresses, whether they be natural stresses or stresses that we put on them, is being eroded increasingly by our own activities as well, which not only creates greater responsibility on human societies for managing the environment more successfully and more sustainably, but it also raises a number of challenges for us and increases the amount of threats that we perceive in terms of economics and health and so on. The evidence for this type of global change is very easy to see. This is a photograph. I'm not sure if the exact part is somewhere in South Asia, where you can see that what was once an upland area covered with woodland and grassland has been largely covered with concrete and with human settlement. From a European perspective, again, from an urban perspective, particularly in terms of city development, we can see from this example a satellite image from the European Space Agency, which shows the distribution of light emitted by human settlements throughout Western and Central and Southern Europe. And we can see very easily the kind of impact that we are having on the planet in this geological period. This period is also characterized and increasingly recognized as being underlined by a number of intersecting global crises. We see difficulties with economic security and economic collapse in recent years, increasing problems of food security and security of nutrition. We have a growing international growing problem of international development, continuing problems with poverty, continuing increasing divide between the rich and poor in almost every region around the world. We have global health issues, we have global ecosystem change, and of course we have issues with energy security and with climate change. It's also increasingly recognized that a lot of these problems, not only are they connected in terms of their causes and their impacts, they're also connected in terms of the solutions that are going to be required in order to meet these. This is a diagram from a report put out by the World Economic Forum in 2010, which recognized that the loss of biodiversity was really at the center of a large number of these global crises. Whether we're talking about climate change or public health or poverty or food security, the loss of biodiversity is one of the central problems that is leading to additional difficulties in those other particular crises. But from a positive perspective, conservation and the wise use and sustainable management of biological diversity and living natural resources is also recognized as being one of the best solutions to addressing a lot of these particular problems. A lot of this thinking has been borne out as a result of the publication of the reports from the Millennium Ecosystem Assessment. This assessment was called for by the then UN Secretary General Kofi Annan in the year 2001. The idea was to look at the state of global ecosystems, to look at how the state of global ecosystems affected human well-being, and to see what the scientific basis should be for policies that would address the difficulties linking ecosystems and human well-being into the future, considering the growing problems of population growth, other demographic changes such as international migration, and economic challenges such as the increased amount of global trade, tourism, and travel. The Millennium Assessment reports, which are all available online at that web address, include a number of synthesis reports, including one that was prepared by the World Health Organization that outlined how ecosystems were specifically important and connected to a number of emerging global health issues. This is quite a famous diagram. It has been challenged and it has been adapted in the years since the Millennium Assessment came out in 2005. But it's very useful for highlighting how different sets of benefits that we get from the environment, the ecosystem services that we get from nature, outlining how they are connected to different elements of human well-being, including human health. It's very much helped to conceptualize this idea of linkages between ecosystems and human well-being and health. This other diagram from the Millennium Ecosystem Assessment also helps to illustrate an important point regarding human well-being. What we see on the left is what's considered to be the extinction rate, the natural background rate, if you like, of species loss and biodiversity loss through time. In the center we see what's considered to be the rate of biodiversity loss in this current period that we're living in and in the recent past. And as you can see, it's significantly higher than what would be considered the natural background rate. And they've also modelled what the future rate of species loss might be if we continue to use the planet and use our resources in an unsustainable manner. Business as usual, if you like. So with increasing loss of biodiversity and increasing erosion of the living natural resources that we depend upon, we see increasing health risks, and we see decreasing health security and also decreasing security in other forms of well-being. Now, from a public health perspective, this has not gone unnoticed, and indeed from a health research perspective, we've seen that the health community has very much gotten on board with a lot of this message, and in fact has since about the year 2000, has really led some of this change in how we view this concept of sustainable development. There was a report out, or a commentary in the Lancet medical journal around the year 2000, which looked at a lot of these issues, looked at the role of the health centre in the new millennium, and called for a broader view of public health, so to speak, a view of public health that adopted values of equity and ecological sustainability. And ecological sustainability was very much seen as being something that fell within the remit of the health sector. Some of the key messages from the Millennium Ecosystem Assessment, I won't go through them all in detail, but something which is important from an urban perspective, and when we're starting to talk about ecosystem services and human health and biodiversity in the urban context, some of these key messages should perhaps be highlighted. From a general perspective, it's quite obvious that where ecosystem services that we depend upon are eroded or degraded, it's only possible for a human population to exist if it is supported by ecosystem services and ecosystem goods that we import from areas outside. And nowhere is that more acute than in urban situations. Obviously, in a heavily developed city, at least in terms of the modern city as we understand it, most of the food that is produced has to be imported from elsewhere. Most of the carbon sequestration and carbon CO2 absorption that we depend upon, it does not happen within the city limits. We often depend on ecosystems externally to absorb the waste products of our economies and our societies. But there are certain types of ecosystem services that we can't readily import. To a certain extent, technology and trade can help to overcome some of these difficulties. But there are certain ecosystem services that we are very much reliant upon, that when we cannot import them or they cannot be replaced by technology and trade, we begin to see specific issues for public health, and I'll mention some of those in a few moments. From the perspective of sustainable development, I mentioned how biodiversity is increasingly seen as being connected and important to a range of international crises. But increasingly we see that health is also seen as a focus of sustainable development. Whereas in the past it was considered that health was something that we could look forward to in terms of good population health, something we could look forward to as a result of sustainable development. Increasingly we see that health is actually a prerequisite of sustainable development. It's hard for development within any particular area to be sustainable if the health of a community is not looked after. One of the reasons for that is because health systems themselves can have a very specific impact on the environment, and because ecosystems can also be affected by population health changes. Perhaps people within an area or a state of low population health have to make specific choices that themselves can have impacts on the environment. So if we kind of pause just for a second and say, okay, well, what do we actually mean by health? The definition of health has been, from the public health sector perspective, has been pretty much set, or the standard has been set by this definition from the Constitution of the World Health Organization back in 1948, which said that health is a state of, is not just a, I beg your pardon, health is a state of complete physical, mental and social well-being, and not just the absence of disease or infirmity. Now at the time that was incredibly important because it recognized that health wasn't just about the personal and individual biological perspective. It was also about wider connectivities with society and with community. But this has kind of been questioned in the last few years. There's been a debate about whether or not that definition needs to be updated. And one of the key points to look at is that health perhaps should, the definition of health should perhaps include greater focus on our ability to adapt to changes. That's a notion that we're very familiar with from an ecosystem health perspective. When we talk about ecosystem health, we talk about ecosystems being healthy when they are able to adapt to challenge, whether that challenge might be a stress from pollution or from climate change or from overexploitation or from some natural phenomenon. Ecosystem health represents a situation where ecosystems can bounce back, can resist change. And that's the same with this new notion of what we mean by public health. When somebody is unwell, it doesn't perhaps necessarily mean they're unhealthy. By that I mean if I have the flu or if I have a cold or if I have a stomach virus, I might still consider myself to be a healthy person if I can overcome that particular illness and bounce back, if I show those qualities of resistance and resilience. The reason this is important is because it begins to show an overlap in the language that's used by the health sector and the language that's used by the biodiversity community. From an international policy perspective, we see, unfortunately, however, that this type of overlap is not really making a difference. We see what's called increasing global scale failures. We see problems of missing institutions. This is an important paper from the journal Science in 2009, which highlighted that despite the fact that we have this international dialogue on sustainable development, that we have this recognition that biodiversity is at the center of a lot of these problems, internationally we're not seeing a lot of joined-up thinking. You have the Intergovernmental Panel on Climate Change, you have the Convention on Biodiversity, you have the World Health Assembly, and all of the other major international institutions that exist to look at these problems, but they don't work very well together, and the problems continue to get worse. So what are the problems? Why are we not working together? Well, obviously there's difficulties in terms of the language that we use, the types of phrases, the types of approaches that we take in terms of discussing the problems that we have, which leads to a general lack of understanding between sectors. We also have different scales of operation. Ecologists and environmentalists often work on very broad scales and perhaps across very broad time scales as well. We take an action that we might begin to see a benefit in 10, 15 or 20 years. From a public health perspective, you're often dealing at a very small level, whether it's the individual or the community, and you need to see very rapid results when it comes to a health crisis. You can't afford to wait 10 or 15 years to solve the problem of growing diabetes or obesity and so on. And we also see these narrow views of functional remits. People in the health sector often believe that the issue of biodiversity or environmental science really doesn't fall within their remit, or it's not really their area of expertise. We also see what I call the environmentalist dilemma, where people are kind of fed up of hearing the story from environmentalists that you must do what we tell you. You must change the way that you live, because if not, there will be some major problem. Climate change will cause major issues. Biodiversity loss will cause major issues. Now, these things actually are more than likely going to occur, these major problems. Some of them are happening now, some of them are on the horizon. But I think people are often looking at the environment sector and saying, you're stuck in the past. We're finished with picking herbs and hugging trees. You need to modernize, you need to come to a new way of thinking. So the language that we use as environmentalists needs to change. We need to not just say this is what you have to do to change the way that you operate in order to protect the environment. It's more a case of us saying, well, how can the health sector and how can other sectors benefit from what we do, or how can we change in the environmental sector what we do in order to improve public health. Now, from an urban perspective, this is a nice aerial photograph I took from the airplane the other day of Dublin City. And you can see that it is, even for a relatively modern city in a country that had the most incredible affluence in recent years, it has very little green. And what green space there is largely just for the use of a select group of people. Maybe it's soccer pitches or golf courses, or maybe just small public parks in certain areas. Now, this problem of urbanization and the growing urbanization of human populations worldwide has specific challenges for biodiversity conservation as well as for public health. This is just to highlight two reports quite quickly. In 2010, the United Nations University came out with a report called Cities, Biodiversity and Governance, looking at some of the challenges that city city managers and city authorities have with regards to conserving biodiversity, highlighting this issue of dependency on ecosystem services from outside, but also saying that as well as being both an incredible problem and challenge for nature conservation and sustainable development, urbanization potentially can be one of the best things for sustainable development in terms of being able to manage problems within a discrete area. And then more recently we've had the City and Biodiversity Outlook report that was published through the Convention on Biodiversity, which highlighted how urban areas are expected to grow over the next 30 years or so, not just in terms of the physical area, but also in terms of the population. And as we know, I think since about the year 2007, the human species has been largely urban. The vast majority of people on the planet live within urban situations. Now, from a public health perspective, we see that there are some very specific and acute public health challenges in urban areas, beyond what might be seen as being the normal health issues within a wider population. There are perhaps 6 key issues. We see the idea that in areas of dense population where perhaps there might be overcrowding, infectious diseases can thrive and spread very rapidly. We also have acute and chronic conditions associated with pollution, perhaps pollution from energy production or from transport. Chronic non-communicable diseases such as cancers, diabetes, obesity and so on that are associated with unhealthy lifestyles. Also injuries from crime and traffic accidents. We have specific climate change related threats in terms of perhaps cities and coastal areas that are prone to flooding, as well as the urban heat island effect. And as I mentioned, there's this increased dependency on importation of ecosystem services within city areas. This is a snapshot of a report that came out in the journal Nature in 2008, which looked at global trends in emerging infectious diseases. And it's useful just to see that there were 2 key messages really that I took from this. So one is that when you overlay the emergence of infectious diseases over the last 60 years with the occurrence of hotspots of biodiversity, the areas on the planet that we consider to be the most important in terms of protected areas and nature conservation, that often there's a great overlap. In other words, as we encroach on protected areas or on pristine areas, as we erode ecosystem services, we expose ourselves to public health threats, and that's a particular problem for urbanization. But also, as you can see in a couple of areas that are kind of highlighted by those boxes, a number of emerging infectious diseases have actually been associated with urbanization, particularly antibiotic resistance and the development of resistance, the development of novel, or the evolution of novel bacterial, viral, and fungal and parasitic infections within city areas. There's also a major challenge in terms of urban health inequalities and in terms of how health systems can cope with various disparities and various problems in terms of socioeconomic status and so on. In terms of health outcomes, socioeconomic status is perhaps considered to be the most important factor in defining somebody's health outcomes, because it affects the resources that people have to manage their own health. It affects their ability to look after the health of their family, to purchase medicines, to access healthcare more widely. There's also problems with gender, with ethnicity, with age and mobility in terms of discrepancies with how people access healthcare and the health challenges that people face in urban areas. And this is a very recently published report which I think is quite interesting. It's a report of the US that looks at patterns of environmental justice or injustice. Basically looked at the issue of impacts of outdoor nitrous oxide pollution in the US, and it was quite clear from that report that there is a wide difference between Caucasian populations and other ethnicities or other ethnic groups in terms of the impacts that they have. Again, often related to socioeconomic status as well as disenfranchisement and how urban health policies actually deal with people from different communities. Now, if we're going to try and address these from an ecosystem perspective, if we're going to try and look at these public health perspectives and try to engage with the biodiversity community in a meaningful way, if we're going to try and have a holistic approach, we need to develop obviously some types of conceptual models, some ideas for easily framing how ecosystems and human well-being in urban areas are related, and at least trying to develop patterns or processes by which these can actually be addressed in a practical way. This is a diagram called the health map for the human habitat as such. It came out from a report in 2006, and it's often been cited as being a very clear way of conceptualizing how people are at the heart of a global environmental situation, and how the different levels, if you like, of society, of policy regulation and so on, affect people. It's been criticized in some cases as being a little bit too much from a top-down perspective and not really looking at the connections between different sections. And so we've seen a whole range of other different conceptual models, increasingly complex, trying to conceptualize how health in urban areas are connected to the wider environment and to wider social issues and inequalities. And we're seeing, as a result of this increasing use of the term the ecosystem approach to health, increasing interest in approaches to health that fundamentally recognize the importance of biodiversity and ecosystems to protecting public health in urban situations. This is a diagram that we often use when we're trying to do outreach with the health sector that kind of looks at how public health outcomes are affected in a policy context. From the top you have the international policy context feeding down to local and national policy processes, down to the impacts of local environment. And you can see where I've marked there with the tick mark the specific areas where an ecosystem approach to health can have the most benefit. And you can see it pretty much covers the entire spectrum. The only area where it's not really that effective is at the household level. Unfortunately, the link with biodiversity is often quite tenuous, and this is where we see a problem with the evidence base. We've seen a lot of increasing evidence of links between biodiversity and health around the world, but in a very local context, often that evidence is missing. So we can point to a number of studies worldwide that seem to show a relationship, for example, between green space in urban areas and improved mental health or improved physical health. But if somebody wants to create some kind of a project here in Helsinki, finding locally relevant evidence is often quite difficult. One of the problems is that the evidence that is required by the environment sector is often quite different from the type of evidence that the health sector considers important. For example, we talk about the precautionary principle. In the environmental situation, the level of evidence that is required to take some action to improve the environment is often quite different than the same level of evidence that would be required to take a precautionary approach in the health sector. So we see a whole range of different reports coming out and new journals. As I mentioned, we have this report from the Millennium Ecosystem Assessment, and we see headlines like this: dwindling biodiversity raises to real disease risk in humans. That report also specifically mentioned urban areas. And we see this increasingly in the scientific literature. This evidence base is being developed, and this problem of the disparity of evidence is being looked at around the world. So just to finish, a few very quick examples of where some of this evidence relates to urban areas. This is an overview of the Greater London area. A very interesting report from 2011 that looked at how urban green space, particularly urban forests, urban trees, are having an increasing importance in terms of cleaning the quality of the air, and in this case particularly removing particulate matter that causes some specific chronic lung disease problems. That report found that about 2% of the total particulate matter that is of concern to public health in the Greater London area is actually removed by trees. So a specific initiative has been taken to increase the amount of tree cover within the Greater London area from a current 20% to over 30% over the next 15 years in order to improve particulate air quality. We also see problems in terms of infectious disease, not just those non-communicable diseases such as lung infections. This is an interesting story from Ireland. It's an anecdotal story. It's not something that's been published yet, but it's something I found quite fascinating, and it's one of the stories that helped me get interested in this particular area. As we know, Ireland had a quite incredible economic boom just before a quite incredible economic collapse. In a lot of areas there was increasing land use change, development of agricultural landscapes to promote urbanization. And this is an aerial photograph. It's not particularly clear, but it's of South Dublin, backing onto the mountains in Wicklow, just on the east coast of Ireland. This urban sprawl in very simple terms, transplanted natural ecosystems. The wildlife and the vegetation that was there was pushed out in order to facilitate development. We increasingly saw that a few years after development was finished and people had settled, wildlife began to move in. One of the species that began to be able to capitalize on urban development was what we now call the urban fox. When the foxes move into these areas, you see an increase, unfortunately, in certain diseases that are carried by foxes and by other animals. And this is a problem throughout many parts of Central and Western and Eastern Europe as well. We have diseases showing up in domestic pets, and as a result also showing up in children that play with pets because they are transferred by foxes. And as a result, we then begin to see, and this is just an example of a study in Dublin called FoxPop, where people are invited to report the occurrence of urban foxes. It's a project that is important not just from a nature conservation perspective, but also from a public health perspective. So when it comes to working with the health community from the environmental sector, there's a number of key challenges. We need to look at integrating ecosystems into health research policy, but also looking at implementing green infrastructure planning, looking at how natural ecosystems can actually become a fundamental part, a bigger part of not natural ecosystems, of man-made ecosystems, can become a fundamental part of urban planning and urban design, so that these ecosystem approaches aren't just incorporated in what the biodiversity community and the health community does, but in what city managers do and city planners and city designers do as well. So I've run out of time, but as I say, there's a number of other slides, a number of other points which you can use yourselves later on, and if anyone has any questions at any stage, feel free.